Hello, welcome. Thank you for joining us today. I'm going to be doing massage for sciatic pain, and I'm going to be working on the lovely Michelle. She is one of the newest instructors for Psyche Truth, and her videos should be coming out soon. So keep your eye out, and I'm going to go ahead and dive right in. So when I am approaching someone that has sciatic pain, I'm really intentional about making some sort of plan, and the piriformis is always going to be some part of that, and just as much so the hips. So sometimes when there's a lot of sciatic pain, the hips can seize up and people can start just holding tension there without even realizing it. This is a really basic technique, just this rocking motion, but it can really help the hips to soften and let go of some of that holding. And even something as simple as this can help with that sciatic pain, just because it's also connected. So it's like a ripple effect of when the hips can soften and relax, the piriformis can hopefully soften a little bit. And like I was talking about, so I like to approach massage in an organized, kind of methodical way. So I'm always thinking about like sequencing and how I can use my time most effectively. And so there's definitely a reason that I do things in the order that I choose. So this is also a chance for me to give Michelle a sort of roadmap for the work that we're going to be doing. So I'm going to be working a good bit on these hips and around this iliac crest. And I'm going to be working on the glutes a lot. So even for someone that prefers deep tissue, I like to do a really thorough warm-up. And if you're wondering why I'm wearing my ring, it's because my hands are actually really swollen and I can't get it off. So I don't usually do massage with any jewelry on. So I'm gonna go ahead and start just some compressive work in this glute medius. And with compressions, there's definitely an art to it. So just gradually starting to sink my weight in a little bit more. And if you're not careful when you're doing deep tissue, you can actually harm the tissue in a way that causes inflammation. So you want to work the more superficial layers of tissue, make sure that they're responding well before you really try to do deep tissue. And that doesn't mean that you need to be overly cautious either, but just be smart and work intuitively, kind of honor what feels right. And I am focusing on this connective tissue around the sacrum. And you do need to be a little careful. Sometimes with smaller framed women, especially, this area can be a little bit bony. So just making sure that I'm not hitting bone. And I really like to take my time with when I'm doing work to help relieve sciatic pain. I like to take my time with the glute medius and the glute max. And then if I feel like everything's responding well, I will probably work on that piriformis directly. But it just kind of depends on the level of pain that my client's in. If there's a super sharp, intense pain down the leg, then it just kind of depends. And I'm going to go ahead and work my way into this glute max. And I'm just going to kind of shift my body, working at a different angle, and I'm going to transition into a different technique that I find to be just a little bit more effective for this big glute muscle. So I'm going to do this active release, and if I sense that somebody's kind of like gripping their leg or their hip, I might just lift this leg up a little bit and shake it. Just really encourage everything to soften a little bit. And also, like, if your client's trying to help you, that's very nice, but making sure that they can just like soften as much as possible when they're getting work done. And really, especially with the glutes, encouraging your client to stay like mentally engaged can be really helpful. And I'm just feeling around for any trigger points. And if the muscle fiber is feeling really ropey, then it's just important to slow way down, because it's really easy to slip off. And if you do find some trigger points to work on, you can explore sometimes a smaller movement is helpful to work through some of that tension, and sometimes a bigger movement can be more effective. So again, just working intuitively and really feeling for how things are responding. And just paying attention to any sort of protective behavior. When there's sciatic pain, can be really annoying, and it can be really intense. So if there's any sort of lifting up from the table or gripping in the hip, like really communicate with your client. It's really important. And because the piriformis is a deeper muscle, you can start to work on it a little bit with a broader surface, but if you really want to get in there, I find that using my elbow is the best tool. So just making sure that, especially because I'm pregnant, I've been paying a lot of attention to obviously making sure I feel good when I work. And so always widening my stance when I get closer to the table and making sure I don't put a lot of weight on my low back. So I'm going to go ahead and start to work on this piriformis. And it took me like a couple years actually to feel like I had the sensitivity in my elbow to do effective work. Like it just felt really foreign at first. But once you kind of get that sense of just really knowing what you're doing, working with the elbow, it's a lot easier, especially when you're working on deeper muscles that are harder to access. This honestly would be so hard if I were trying to do it with my thumb or even stacked hands would feel a lot harder. And if the piriformis is responding well and is not trying to protect itself, you can actually create some space around that sciatic nerve. But if you're trying to force the piriformis to respond, it really never works. So it's just really honoring the process and not trying to force anything. Most of the time when I'm doing glute work for sciatic pain, I do dry work. So I don't really do petrissage or effleurage. I do a lot of active release and compressive holds. I just find that it's more effective. And I think it's important to not have expectations when you're doing massage. So, offer your best work and kind of leave it at that. But expecting your client to feel any certain way as a result just kind of isn't very helpful. So I'm going to start to work my way into the low back. And so my focus today, the plan that I kind of made was, so kind of start with that glute work. And I'd really like to work on this thicker connective tissue around the iliac crest into the sacrum. So I'm going to grab my oil. And just because it's easier to show you guys, I'm going to go ahead and do both sides rather than one side. But I'm not going to do both sides of the glutes. So if you're doing this at home, definitely do both sides. So if I were doing this for a client, they would be under a sheet and it would be a lot easier to get this kind of range of motion that I would like. Always when you're gonna go below, like this would be like below the bikini line, but really it's below where the sheet would be. I'm always very sure to communicate with my client that they're comfortable with it. But it just feels so much better when you can bring this sort of effleurage stroke into the hips. It's really healing for this issue of sciatic pain. If you can just create more softness in that connective tissue in the hips. And I'm just gonna make sure that you have plenty of oil in here. And so you can approach this area more broadly if you're not as comfortable or you aren't really sure what you're doing. So just this very simple effleurage technique. So I'm just working on this connective tissue along the iliac crest. And it's, like I said, it's pretty thick. So don't be afraid to use a good bit of pressure. And I really like to stack my hands and use this technique. And just by helping all of this to relax and soften and become less sticky. You're hopefully creating more space, kind of indirectly encouraging that sciatic nerve to soften, just everything around it. And so this was a really nice way to kind of start to offer a little bit more pressure. If I want to start doing deeper work, you always want to be working towards and into the muscle or tissue that you're focused on. But this is a really nice way to start. And I just really like to start working on this tissue from different angles. You don't have to do anything super fancy here to be really helpful. So just circular frictions. You can do, can work with your forearm into this tissue or your elbow even if you want. But it's really good if you can kind of spend some time with your finger pads or your thumbs just to get a really clear idea of what side might need more work or just how things are feeling in general. And there's different ways that you can do these compressive movements. You can stack your thumbs or your hands. Whenever I'm stacking my thumbs, I'm sure to alternate because they tend to get tired pretty quick. So the key here is to be making direct contact with the connective tissue and not to be just hitting bone. So do need to be a little careful. And so I usually like to end my routine for sciatic pain with getting into some of these nerve endings. So this is another thing that I do always communicate with my client. So can also do it on top of the sheet or whatever you're working on. So just making sure that I'm applying a good bit of pressure all the way to towards the tailbone. So just really encouraging all of that to relax. And just little pieces of information that you can give your client to like help them. So just, I'm sure that a lot of, if you are a professional therapist, a lot of clients don't know that there's a lot of nerve endings there. It's just kind of fun for you to share that kind of information. And I don't really like to end with anything like too detailed or pokey. So just kind of working on that connective tissue around the spine a little bit, doing something a little more soothing to finish. And before I forget, I'd like to thank a few of our patrons. I'd like to thank Matt C., Dill S., and Charles Wallace. Thank you all so much for your support. And that's all for today. Thank you for joining us today. If you enjoyed today's video, you should check out our Patreon page where you'll find some exclusive content that I think you'll really enjoy. I look forward to seeing you there.